EmEx, improving performance, recognizing excellence. Convinced your emergency department is a top performer that deserves national recognition as a center of excellence? Concerned that your ED can perform at a higher level and not sure where to begin the improvement process? Emergency Excellence, or EmEx, represents an opportunity for hospitals to determine whether or not their ED truly excels. This project intends to raise the bar for the entire country. After data analysis, benchmarking, and surveying key stakeholders, EmEx compares your ED to those of similar hospitals in our database. This helps identify where you can most effectively improve patient care and efficiency, as well as control costs. And EmEx awards the Emergency Medicine Center of Excellence designation to hospitals with superior performance, the first national designation to recognize superior emergency care.
Dr. Scaletta, what led you to develop EmEx?
In 2006, the IOM published a landmark report, Hospital-Based Emergency Care at the Breaking Point, which described our overcrowded and underperforming emergency care system and challenged us to establish evidence-based performance indicators. The specific IOM recommendation that resonated with me was hospitals should adopt operations management strategies to improve the quality and efficiency of emergency care. I decided to try to classify the distinct factors at play in a best-performing emergency department and identified 7 distinct pillars of excellence. In fact, the EmEx logo serves as a visual reminder that the overall strength of the emergency department requires each pillar to bear its load. Then, Mark Reiter and I established key performance indicators, KPIs, that would effectively assess the integrity of each pillar. Essentially, these are benchmarks matched to the pillars that give a meaningful way to make an apples-to-apples comparison of participating hospitals. We reviewed the literature and identified over 100 KPIs, and then developed a ranking method so that the more important KPIs are given additional weight when scoring a hospital's performance. After a year of planning, we started working with a programming team and developed EmEx Compare, our core product. This led to a recognition solution for high-performing emergency departments, EmEx Award, and the Emergency Medicine Center of Excellence designation, as well as an improvement solution for those that need help, EmEx Consult.
What is the business argument for a hospital to invest in EmEx?
Your process improvement team will learn where your performance lies relative to comparable hospitals. And by addressing weaknesses, identifying strengths, and incorporating best practices, it will build up staff morale.
How does a hospital get you the data you need?
We use a web-based survey tool to relay actual performance data from the emergency department leaders. In addition, we have a user-friendly method to survey your key ED stakeholders, including emergency physicians, emergency nurses, emergency residents, mid-level providers, medical staff, and administrators.
EmEx Compare is our core product and includes KPI benchmarking, stakeholder surveys, and a comparative analysis of your emergency department relative to similar hospitals and best practices in the EmEx database. You will receive a comprehensive report allowing you to easily see where your ED ranks and where ripe opportunities lie. You will gain access to the ED Toolkit, a resource of clinical policies, protocols, guidelines, order sets, and education tools. For hospitals with superior performance, upon on-site verification, EmEx awards the Emergency Medicine Center of Excellence designation, the first national designation to recognize superior emergency care. Finally, with EmEx Consult, we perform a comprehensive on-site evaluation of your ED, as well as in-depth dataset analysis. We focus on areas of deficiency and identify achievable opportunities for improvement. EmEx assists you in creating detailed process maps to identify bottlenecks and opportunities that will save time and resources. We help hospitals prioritize needed solutions and institute a rapid improvement plan. EmEx, improving performance, recognizing excellence.